live on Radio Chiriquí 103.3 FM. Today, I don't have a guest. And while that happens occasionally, this time I've decided to go ahead and do the show alone. So we will see how it goes. Very first time doing a solo act. I would like to thank Zuleika, who is my engineer today, and down in David, Veronica. Thank you very much for passing us the signal today. Have a very happy weekend. And I'd, of course, like to thank Roger Guerra, who is the station manager up here in Boquete. He does a great job keeping us all informed. He puts out daily blogs. He has interesting shows on, and he provides the time for the expat community to get information and music and all kinds of fun stuff in the English language. It also helps our local communities with understanding English, learning a little bit more, picking it up, understanding a bit about the expat culture in our community. So today is Saturday, the 17th of September. Man, is this year going quickly. We're already what is it, like 100 days from Christmas now, for those of you that celebrate Christmas. And just a week after that, it's going to be the new year. And boy, what a year it's been. Lots of changes this year. We're starting to learn to live with that dreaded virus known as COVID-19 or SARS-CoV-2. I'm trying not to switch into Spanish. Sorry about that. Every once in a while, I switch into Spanish, unintentionally, of course. So what's new out there? Well, there was a new decree 2 days ago that was published in the Gaceta Oficial. What does that mean for our community? Well, for one, they've lifted some more of the COVID measures that we've been dealing with for the past couple of years, such as physical distancing. That's no longer going to be obligatory. Although still recommended, obviously, and especially if you're sick, you should probably keep to yourself and not pass your cooties along to others. The other thing that's been lifted is requiring that restaurants and stores open at reduced occupancy. Now they can open to 100% occupancy. That does not mean that your servers and your meal preparers are going to be taking off their masks anytime right now. You also are required to use it in clinics, hospitals, laboratories, basically medical facilities still require using a mask. And I know that a lot of you that have gotten used to not going around with a mask show up to the clinic without wearing a mask or without even bringing a mask. We don't have extras at the clinic, so you must bring your own, and it's obligatory to wear it both coming into the clinic and in the waiting room as well as in the exam room, unless we ask you to take it off. And that's by law for right now. If we don't follow those guidelines, then we get sanctioned. So let's avoid the clinic getting sanctioned. Let's keep everybody safe. It's still recommended that you continue to mask enclosed spaces with a lot of people around you. And also, if you're sick, stay home. We still recommend for certain people, especially at-risk people, when you have symptoms, get a COVID test. Just because it's good to know, and it's easier to treat if we know what is going on with you. Not all colds and lung infections are COVID, obviously. We have had a lot of pneumonias going around, a lot of viral infections going around, diarrheal infections. It's rainy season, the pipes break, the water gets contaminated. So take that into account. If you are having symptoms, go see your doctor. There's been a nasty cough going around. Most of those people are coming back negative for COVID, whether it is or whether it isn't, because our tests are missing a lot of COVID infections. We don't know, but I do know that it has produced a lot of cases of pneumonia. I've seen a few cases just this last week. So, continue to protect yourself. We weren't seeing these things when everybody was masked up. So, yeah, masks were working. you know, if you go on a trip, if you go on a plane, it's still recommended that you wear a mask. It's not obligatory. I don't know. I believe still in within Panama, any public transportation, you must wear your mask. Obviously, if you are at risk, cancer or immunologically affected, then you must wear your mask as well. Sorry, I had a little brain misfunction there. What else does this decree say? It states that to come into the country, it is no longer necessary to have a QR code, and it's not necessary to produce your vaccination record. And if you are unvaccinated, you don't have to be tested before you come into the country. That's as of now, okay? That was just recently passed. We shall see how that works out for us. But like I said, you know, especially if you're at risk, and the more people that are vaccinated, the better. In our communities, that protects everybody. If you can, get vaccinated. There is a new bivalent vaccine that should come to our country eventually. I'm not sure when, but it's already out in the States. What does bivalent mean? It means that it protects you against 2 of the newer variants of COVID specifically. Okay, it's kind of like getting your flu shot, which might have 2 or 3 or 4 different variants in it. The COVID-19 vaccine, the bivalent, has 2, bi meaning 2. And it's just going to be a single booster dose each year, just like getting your flu shot. Because we are seeing that these new variants are highly contagious, they are producing hospitalizations in those at-risk patients, especially the ones that aren't vaccinated. The U.S. is still getting about 500 deaths a day from COVID. So yeah, it's still recommended that you protect yourself just like you would against any other vaccine, any other virus, washing your hands, watching your distance, staying home if you're sick. We're seeing a lot of people that are finally coming back to see their doctor for follow-ups for controllable illnesses such as diabetes and hypertension that haven't been to a doctor for a few years. So they're not doing the best with the medications they have, or they've stopped taking their medications, or for one reason or another, their medications just aren't functioning as well. So come see us, get your labs done, do your yearly physical. If you haven't done your mammogram, if you haven't done your pap smear, come see me. We can get those taken care of. We've been detecting some breast cancers and other types of cancers. We've been detecting diabetes out of control that needs extra treatment to get it back under control. So definitely you want to come see us if you are having any issues with your health. So that covers the newest stuff. I did pull up something that I thought you'd enjoy, some interesting health facts. Okay. So did you know that 1 in every 1,000 babies is born with a tooth? I didn't know that, to tell you the truth, not until I read it. Also, let's see. Each person sheds about 22 kilograms of skin in his or her lifetime. That's like over 40 pounds. And did you know your heart beats about 100,000 times a day? How much is that in your lifetime? Also, let's see, what was I reading about? Oh, okay. Yeah, when you were born, you had 300 bones in your body. As an adult, you have 206. What happened to the rest of those bones? Well, they didn't just dissolve, they didn't disappear, they didn't fall out. They just fused together. Also interesting is that your feet contain the most bones as compared to any other part of your body. that's really interesting that our feet have so many bones in them. Let's see. Your kidneys can filter your blood up to 300 times per day. Your red blood cells last about 120 days before they die off. Let's see. There are about 96,000 kilometers of blood vessels in the human body. That is very impressive. So, you know, just some interesting facts to keep you informed on medical stuff, and why things are the way they are. We don't know why some babies are born with a tooth. We don't know why some babies are born with a lot of hair and why some babies are born with almost no hair. So that's just some interesting facts to, think upon while you're enjoying your Saturday morning breakfast. So I think right now we're going to go to a musical break. Zuleika has some music set up for us. So right now we're going to hear La Ley, Mentira.
Se da y no se mira, mentira, fundida
And we are back. So, just to mention, getting off the subject of COVID and COVID prevention, last Saturday, which I did not have a show, was the commemoration of the National Day of Suicide Prevention and Suicide Risk. It's important to mention that, yes, it does exist here in Panama as well as in other countries, and there are resources available to the public to help with suicidal feelings, all kinds of crises that people just don't know exist. There have been decrees and laws established to help identify and treat and prevent suicide as well as other psychological problems. It's not just here in Panama, as you know, it's also in the rest of the world. During 2021, Social Security Hospital here in Panama reported over 1,000 suicide attempts. In the entire world, we're looking at one death by suicide every 40 seconds, which is a whole lot of suicides. We're talking about 800,000, somewhere along there. So it is important to know there is help out there. Your first thought might be going to your primary care physician. If you're having feelings of depression, anxiety, sadness, hopelessness, we should be your first stop. Come see us. We can talk about it. We can tell you what needs to be done. We can refer you to specialists. If you're in crisis, there are other organizations and phone numbers that can be called. If you have a friend or someone in crisis, you can call 911, which is our emergency hotline here. Explain the situation. The police are always there to help as well if there is a current suicide attempt threat. They are available to help as well. We have our mental health center also, as well as our Ministry of Security has a number that you can call to get help, which is 561-2661. I'm looking up the other numbers as we speak, which is why I sound a little bit distracted. There are other numbers. Give me 1 second. Where did they go? For example, for women in crisis, abused women in crisis that need help, there is available a National Institute of Women right here in Chiriquí that you can call 774-7093. It's really important to know that there is help out there. There are places women can go where they can feel safe, where they have somebody to talk to. There are centers where they can live to get away from danger until they are able to get back on their feet. There's so much out there. There is Casa de la Mujer. I'm not sure if it still exists, but there was Casa de Mujer here in the Chiriquí province for housing women in crisis. Mides has a number for psychological attention and emotional support. It's line 147 on your cell phone. That was mostly during the COVID crisis. I'm not sure if it's still available. There is also, let me get to it. believe it's 162, option 2. Let me confirm that with you. Let's see. I'm looking it up. Here we go. Open. Internet's running a little bit slow, sorry. Okay, so there is a hotline for psychological attention, 678-7876. As I said, there is the National Institute of Mental Health, 523-6800. The White Cross is 6674-9695. Where is the other number? 169, option 2 is psychological attention as well. So there are resources out there available, but your first stop, if you're in crisis, come see your health care provider so that we can refer you on to someone that can help you with whatever you need help with, and refer you to someone that can continue to offer that support that you need, and possibly medication. What else is there to talk about? Well, there's been a lot of talk about long COVID. That's been a big kind of thorn in our feet, trying to figure out what is the cause of this long COVID. Why are people that get over COVID having symptoms weeks to months after they've gotten over the original COVID infection? There's so many people that come to me that start talking about, well, you know what? I had COVID. It was over a month ago. I still have a cough. I'm still worn down. I'm still, getting out of breath while I'm walking. I've had either have had or have not had vaccinations. It doesn't seem to matter whether you've been vaccinated and you get sick, or if you have not been vaccinated and you get sick. Either can suffer from long COVID. So what is this long COVID that we're talking about? Well, usually it's more than 4 weeks after you've had an infection that it occurs. Or not occurs, or continues, I should say. Although you can have no symptoms for a while, and then all of a sudden you get recurrent symptoms. There is no test for it. We can't test for it. We can only diagnose based on your health history and whether you had COVID, either by a positive test or the symptoms that you've had. So what are some of these symptoms of long COVID? Well, if they persist more than 4 weeks or even months after the infection, we consider that long COVID, as I said. What are the general symptoms? Tiredness or fatigue. And this is something that usually interferes with people's daily life. Like, I just can't get up and go to work. I'm just too tired. Or symptoms that get worse after physical or mental effort. Fever. A lot of people are still getting fever even a month after having COVID. There are respiratory and heart symptoms, such as difficulty breathing, shortness of breath, cough, chest pain, pounding heart, palpitations. A lot of people are talking about this COVID fog. What is COVID fog? Well, they just can't seem to concentrate. They can't remember things. They can't concentrate. Short attention span. Headaches, sleep problems, dizziness, changes in smell or taste. Some people have lost their sense of smell and taste months ago, and it still hasn't come back. Some people are still getting diarrhea or stomach pain, joint or muscle pain, rash, and we just can't figure it out. So what do we do when a patient comes in and we suspect that they might have long COVID? Well, we do routine testing, such as blood tests, x-rays, EKGs. These things may or may not come out normal. We can take, exams of different organ systems, kidneys, liver. Some people do special testing to find out their lung capacity. But we're finding that this virus is leaving a lot of sequelae. A lot of people have continuing symptoms, and we're afraid that these are going to continue on for many years. It seems to be predisposing people, especially at-risk people, for diabetes, heart conditions, even neurological conditions, psychological conditions. And this is much higher than the non-COVID groups, those that have not gotten COVID. It happens whether you've gotten really severe COVID or really mild COVID, which is interesting. I mean, why would it affect people that weren't affected as strongly by the illness? Some have even post-traumatic stress syndrome after having suffered from severe COVID, especially those that were in ICU, intubated. We are seeing that the severity can cause PTSD-like symptoms. Who might be at risk? Well, people who have more severe COVID, especially those who are hospitalized or needed intensive care, are the ones at risk. Those that have underlying health conditions that existed even prior to COVID. Those that did not get a COVID vaccine, obviously, as we've talked about. And of course, those who experience this inflammatory syndrome that affects different organs in your body. How can you prevent COVID, long COVID? Well, protecting yourself from getting infected is one, getting vaccinated, wearing a mask. You're less likely to experience breakthrough infection, less likely to need or have post-COVID conditions if you are vaccinated as compared to unvaccinated. Some of these people, this is very new for us, but some people are requiring attention long after for long COVID, and we are still trying to figure out how do we treat this. We don't even correctly understand the causes of it. How do we treat this? So we estimate that about 13.3% of the population at 1 month or after are experiencing long COVID symptoms, and 2.5% even 3 months or longer after having had COVID, and more than 30% at 6 months among patients that were hospitalized. So if you're hospitalized, that's a greater risk that you're going to have more symptoms for a longer period of time after you get over the illness. So what are we doing? We're trying to identify the most frequent symptoms and diagnoses experienced by patients post-COVID. We're trying to understand how many people are affected, how often they develop post-COVID symptoms. Like I said, we're still trying to figure it out. This is still fairly new to us. Other illnesses such as influenza and things like that have been around for decades. So we already know what we need to know about this, but not with COVID. Not so. It's different. This is a whole different beast. We have to try and identify groups that are most affected by COVID, or that lack access to care. And also understand the role that vaccination plays in preventing post-COVID symptoms. It's very complicated. It's going to take time to figure it out. And meanwhile, there are many people that are just having trouble getting over it, trouble getting back to work. It's even been declared as a disability under the American Act of Disabilities. This is how serious and debilitating the long COVID can be. So that's why we continue to insist the best way to get over or to not get long COVID or to not get these things that are happening like heart attacks and blood clots and other things diabetes is to prevent COVID. And the best way to prevent COVID is using your mask, washing your hands, and of course, getting vaccinated. All right, so we have another musical break coming up. The Police, Every Breath You Take is our song. Enjoy. And we are back online. I hope you enjoyed the song, The Police, Every Breath You Take. Great song, great group. Don't hear them that on the air that much anymore, but still very popular. So I had a few comments on an article that I posted on my wall on Facebook. I guess it was earlier this week, and it's on the artificial sweeteners. Are they good or bad for you? Okay, we know that a lot of sugary drinks, a lot of sugar in our diets is unhealthy, especially for our teeth. Unnecessary calories help us put on more weight, and it has very little nutrition. And while the body does need sugar, that's true, the brain needs sugar, your muscles need sugar as part of your energy, it's also true that too much of sugar is a bad thing. So, artificial sweeteners were invented, and these artificial sweeteners were supposed to be better for you, especially if you are diabetic and really have to avoid sugary things and carbohydrates that can be converted into sugars. And remember, I mean, there's really no other way than avoidance when you are diabetic, even when it comes to things like fruit, because fruit contains sugar. It might be a good sugar, but it still raises your blood sugar. And it's not good for anybody's blood sugar to be up. So you do have to limit the amount of sugar you're getting from fruits, from pastas, from rice, from potatoes. If you're worried about your blood sugars and you're trying to control them well, whether you be diabetic or not, there are resources online that provide the glycemic index for different foods. Glycemic index is how much it raises your blood sugar when you eat certain foods. And this will help you limit the things that are raising your blood sugar in your diet. Like as I said, it's really important to control that blood sugar. Diabetics tend to suffer from eye problems. They suffer from heart problems, heart attacks, strokes. They're more likely to suffer from silent heart attacks, kidney disease. When you mix it all together, being overweight with high blood pressure and diabetes, you're just a walking time bomb. These things can be controlled. It can be gotten back under control, but you also have to put your part in. You have to watch your diet. You have to do more exercise and take your medications religiously. Okay, so what's up with the artificial sweeteners? Well, in Nat Geo, it was just recently published that low-calorie sweeteners might not be as good for us as once originally thought. We find artificial sweeteners these days in just about everything. Sodas, desserts, cakes, pies, cookies, everyday cooking. Some people prefer to substitute artificial sweeteners as opposed to using just regular sugar or other types of sweeteners, such as honey. Well, this new study suggests that artificial sweeteners may not be as harmless as we thought. In fact, they could increase the risk of diabetes or weight gain. There has been a suspected link for a long time between artificial sweeteners and obesity. Now, how can this be? This isn't sugar, right? This is artificial sweeteners. Well, now in this trial that Israeli scientists, they seem to be doing a lot of trials, have done, they have tested these artificial sweetener chemicals, and they are chemicals, in humans. And they show that not only do they disturb the microbes living in our gut that are responsible for supplying different nutrients to us, such as synthesizing vitamin K, digesting dietary fibers, and among other things, but it also may impact how quickly the body removes sugar from the blood after a meal. And the longer sugar stays in our bloodstream, the greater the risk of diabetes, cardiovascular disease, and chronic kidney disease exists. Okay? So in other words, not only is it affecting our gut microbes, the bacteria that live in our gut, changing the way we produce certain minerals, certain vitamins, or absorbing our food, it can also lead to the blood sugar being raised for longer and causing different types of diseases. People were hoping to be able to use these artificial sweeteners and not have to deal with the calories associated with using sugar. But unfortunately, we're finding maybe these aren't so good for us after all. When you have a change in your gut bacteria, it can lead to chronic intestinal inflammation. It causes an imbalance. We can also see more colon cancer because of it. I'm not linking artificial sweeteners to colon cancer. Okay, we're just linking it to changes in your gut bacteria. Um, so, we recommend, or I don't know what to recommend anymore at this point, but in my family, we tend to use more the natural sugars um, and honeys and that kind of thing to sweeten rather than use these chemicals to sweeten. Is it the same are all artificial sweeteners the same? No, they're not all the same. They're finding that certain ones are better for you or worse for you than others. Um, so let's see, it says that saccharin was the first commercialized non-nutritive sweetener. Okay, basically, they discovered it in 1879 in coal tar derivatives at Johns Hopkins University. So I guess Theodore Roosevelt thought this artificial sweetener would be a great way, guilt-free way to lose weight, but still have the sweet taste in his food. So it was not banned, although they were trying to ban it in 1977 because it was suspected of causing cancers in rats. So many Americans said, no, we need this, and sent their letters to Congress, the FDA, and even President Jimmy Carter protesting the ban. So ultimately, they only required that a possible cancer warning label be applied to products containing saccharin. But even this was dropped. This warning on saccharin-containing products was dropped in 2000, the year 2000, when they found that saccharin actually is processed differently in humans than in rats, and it didn't seem to pose a cancer risk for humans. So saccharin no longer has that warning label. So what are a few facts with these sugar substitutes? Well, it's been found in thousands of beverages and foods worldwide, and it's about a $21.3 billion business, at least this past year in 2021. And of course, this number is expected to rise with the demand for these artificial sweeteners. They found that about 80% of children and more than half of adults consume low-calorie sweeteners once daily. And obese adults use low-calorie sweeteners more frequently. So, it's kind of food for thought. So in 2014, another study found that saccharin, sucralose, and aspartame each raised blood glucose of mice to levels that were significantly higher than those mice that were fed sugar. And interestingly enough, we did this in my own home. We did this unofficial study between blood sugar between artificial as well as natural sweeteners. And we took blood sugars, and we found that artificial and sweeteners, in fact, raise blood sugar more than just regular sugar. This is not to say go out and buy a bunch of sugar and start loading your food up with it, okay? It's just, it gives you food for thought to think, okay, so what's this artificial sweetener that is a lot of chemicals going into my body and raising my blood sugar and possibly causing me more problems than just using regular sugar, right? So, this was in mice. So then they decided, well, does the same thing happen in humans? So they did screen a bunch of volunteers for low-calorie or zero-calorie sweeteners, and they found 120 adults that hadn't been exposed to the artificial sweeteners yet. And they gave them one of four commonly used sweeteners, saccharin, sucralose, aspartame, and stevia, for 2 weeks. They were then monitored for a third week, and they compared their blood glucose responses against those who were not given artificial sweeteners. Well, within 14 days after beginning any of the four tested artificial sweeteners, they observed significant differences in the populations of gut bacteria among the volunteers and the molecules they secrete into the blood. So this suggests that the gut microbes rapidly respond to the sweeteners. To test how the artificial sweeteners affect the body's ability to control the surges in blood sugar after consuming sugar as part of meals, they were monitored for their glucose levels after a test drink. So normally blood glucose levels should peak 15 to 30 minutes and then return to normal within 2 to 3 hours. If the glucose levels remained elevated, it signified that the body wasn't processing and storing the glucose properly. And that is known as glucose intolerance, which is what we see in a lot of diabetics. So they noticed that sucralose and saccharin actually push the body towards a glucose intolerance, which, when sustained, can cause weight gain and diabetes. Aspartame and stevia did not affect the glucose tolerance at the tested ingested levels. So we know that at least 2 of those 4 are affecting the gut microbes, and they are causing the blood sugar to be raised and having the body be intolerant to the glucose. So, it's just something else to think about, whether these sweeteners may be or may not be worse than using just regular sugar. Now, obviously, if you're diabetic, you want to limit your sugar consumption, whether it be artificial or whether it be regular sugar, because we already know the risks. And just watching your weight, watching your diet, and, trying to eat as healthy as you can and do exercise. We're going to go to another song. I can't read this. No entiendo. No entiendo la letra. But we're going to listen to it, and we're going to have a few closing thoughts after we listen to this song.
Hora, 10:54 de la mañana. Hora, 10:54.
Okay, so we are back for the last few minutes, just to touch on a few things. Um, Someone asked, can you be overweight but healthy? Well, that's kind of a double-edged sword, right? You can be overweight and healthy, but overweight is the precursor to obesity. Overweight also puts a little bit more strain on your joints, puts a little bit more strain on your heart, and can cause you to become diabetic as well, okay, because you've got more fatty tissue, and it can increase your resistance to glucose or insulin resistance. So is it possible to be overweight and still be healthy? Yeah, if you're not don't have any underlying conditions such as diabetes or hypertension or anything that puts you at risk, sure, you can still be a little bit overweight and be healthy. But remember, this can still predispose you to becoming obese. Overweight people are more likely to go on to become obese, and it can actually raise your blood pressure, raise your blood sugar, and do damage to your joints. So while, yes, you can be healthy, it probably won't last. Something was pointed out to me. We don't usually weigh patients in the clinic. We weigh children, we weigh pregnant women. Our average patients, unless they're mentioning, that they're putting on a lot of weight or they're losing a lot of weight, we don't usually do weight control. But patients normally tell us, okay, I notice I'm gaining weight, what can I do? Or I notice I'm losing weight, what can I do? And we can tell, by looking at someone that, there are cases that it's obvious that the person is overweight or obese, and, we do guide that person in losing weight and bettering their diet and doing more exercise. So yeah, it's still important to maintain a healthy weight, to maintain a healthy diet. But for now, that's all the time we have during this show. Let's continue talking next week on Talking with Your Doctor with Dr. Shannon Tour. I'd like to thank you for tuning in today and listening to me ramble. Hopefully you found it interesting and got some good information out of it. Everybody have a wonderful weekend, and we will see you next week.